My name is Matt Walsh. Just a little bit about my background so you know who I am. I was in higher education for 20 years at Duquesne University. I actually started out as a campus minister. And I worked with students, and we was really good in a sense of when it came to creating spaces where students felt belonged, right? We were really good at kind of helping them with meaning making and purpose, right? And kind of, the kind of spiritual side of it, the existential side of it. But in my work with students, I realized that it wasn't enough, right? I needed some more psychological sophistication to work with students in higher ed, right? And so that got me onto the path of really looking into counselor education, right? Because they needed some more skills for their own kind of development where they were, identity formation that I didn't have. And so I continued and I got my master's degree in counselor education and ultimately my doctorate in counselor education as well. My experiences at the university have always been, what is the lived experience of the student? What's the lived experience of the environment that they're in, right? And I was always interested more in kind of a bottom-up look at an environment and even research, right? Community-engaged research. And because of my experiences with students and doing kind of cross-cultural mission trips, right, and looking at kind of students who were on the margins of society as well, right, I began to make some connections with how could I bring these in when it comes to my work as a therapist in the counseling realm. In about 2012, I, by happenstance, not necessarily happenstance, I think it was coincidence and kind of meant to be, I was introduced with he wasn't a father at that time, but Reverend Paul Abernathy. And he was an African-American Orthodox priest, actually, who had just begun to kind of come into, set up kind of a community space for individuals I'm from Pittsburgh, Pennsylvania. And there's right outside in kind of the city there, it's called the Hill District of Pittsburgh, and it's predominantly a black neighborhood, African-American community. And he said, he was also a vet as well. And so kind of coming back into the community, right, lots of community trauma happening. And he said, but there's this community trauma and the violence that's happening, but it's different than what I experienced in the war, right? Because it's not post, right? It's continuous. But also, we haven't defined it very well for this space. And we really need to get in to have some conversations about how community trauma looks in this space, because that's the only way we're going to begin to then think about how can we intervene? How can we have places of healing? And so we got together, right, over coffee and had conversations, and we started to have community conversations and really talking about community trauma and what it actually meant. And from those conversations, we're like, you know what? This would be really good. I think I had to do this little paper called a dissertation, right? That this would be a good way to kind of merge these two in a sense of these skills, in a sense of the background, in a sense of trauma, the effect on the person, and how we could come up with a community-based intervention. And so we did that. We set up, we had different kind of focus groups. We used a consultative workshop method, if anybody is familiar with that. The WHO, right, it's a really great way to shift those power dynamics because there's a historical distrust of me as an academic and as a white male, right? To go into a space that you have to be kind of invited in and have people that are there, and then we could begin to kind of talk about the experiences people are having. So from that experience, we created what is called trauma-informed community development. And what it did is it really went after the micro part of the community on the block level to affect the macro. It was a bottom-up approach, right? That became really important. And we had to have individuals that were from the community that were leading it, right? And so from that experience, right, people began to say, well, that's a different approach rather than that manualized care, right? One size fits all. But this bottom up to really affect the well-being of the community. And the other reason I tell you this is that so much of our work is in the consultation room. People come to us, right? But the real challenge and the real kind of intervention that needs to take place is in the environment, right? It's out into the community, right? When the environment is not doing very well, yeah, we do great work and we kind of patch people up, but they're going right back into the same situation. So this model is about affecting, right, the environment. It's a cultural therapeutics is what we're trying to offer, right? So this was a long-winded way in a sense of talking about myself and where I'm at, because it's important, I think, to put it in context of where I'm coming from, where Dr. Edwards is coming from, right, is we're shifting it to more of an ecological approach, right, to look at those protective factors and risk factors in the environment, right, and where can we increase protective factors and reduce those risk factors, right, and really affect change, because we're talking about cultural change is what we want to do. So I also worked in the counseling center for almost 10 years as well. So I did psychotherapy with students, right? And again, the increase that's happened over the last 10 years has been exponential in the sense of who we're seeing, okay? Now I want to talk about Dr. Edwards, who has been one of my mentors. He was also my supervisor. He was the director of the counseling center at Duquesne University. And he really is kind of a visionary. He's a philosopher by heart, right? And looking at, what's coming forward. And so in 2012, 2013, he actually proposed a well-being course. This was before Lauren Santos at Yale put together the happiness thing, and it all blew up, right, in a sense of that. And at that time, because it was so new, administration were like, a well-being course? What do you need that for, right? And oftentimes when we have, it's the trendsetter universities that kind of set the stage for all of us, right? So it didn't necessarily fly, but persistence was saying, hey, we have to kind of redefine the counseling center in itself. And so in 2016, he was able to establish the Center for Student Wellbeing and brought in recreation and health services and counseling services under one umbrella to begin to really work together. And this is really kind of the foundation, right, for this work today, right, is bringing in all of these different partners at the universities to promote well-being and not just being reactive. Okay. All right. Any questions so far? It's a long introduction. Okay. So this is what I'm going to do, right? So thankfully yesterday, we had Dr. Schofield, right? So we don't have to spend a whole lot of time, but I do have all of these slides, and it's always nice, right, when you have a keynote that kind of addresses all the things that you actually put in here. So it's like, all right, thank you. Really looking at this from a public health approach and a bioecological perspective, right? That what's upstream that we need to begin to get at before things become a crisis, right? Now, we also want to look at this paradigm shift, right? Where from it's a customer service orientation to a therapeutic orientation, right? And I'll explain that more, right? And then it's really about this integrated model of care and what that can look like on your campus. And again, every campus is going to be uniquely yours, right? So there's not going to be a one-size-fits-all. And then I want to share with you some preliminary kind of data findings that we've had from Duquesne over the last 5 months, right? It's preliminary. So we've done some kind of qualitative research, some interviews with some students that I want to share in a sense of them beginning to practice different therapeutics and how it's impacted their well-being on the university. And also share some stats when it comes to using some technology like Oasis and our chat support and different features and how that can affect student populations as well. Okay. And then, of course, next steps. So you all, right, very familiar with this report after yesterday. I just want to highlight a few things because it's important to our conversation here today. Okay. We already know about the clinical load index, right? this right here. I don't know if I can get this part right. Institutions cannot fund counseling centers at a level that yields high annual counselor caseloads and currently expect those centers to provide enhanced care for students with any high intensity concerns. Right? We can't fund our way out of what we're in. Okay? Does that resonate with people in the room? Yeah. Okay. Other parts here, right? This is the big thing, right? Because we have it as CAPS departments, as counseling centers, right? We have the administration that are now looking to us when it comes to retention. Their ears peak up when we start talking about retention issues because that's dollars. And in my experience and looking at the trends, right, enrollment is down unless you're one of the big institutions. And so this is a way, right, to begin to get that change talk when we talk about how counseling centers are part of retaining students, right? Okay. It's a pretty big number, right? Almost 30% of full-time college students drop out between their first and second year, right? So again, early intervention. And it's not just from the CAPS department, but how are we getting in? Because this is faculty and staff as well, right, that come into this picture. Okay? Just different risk factors, and we heard about these yesterday, so I'm not going to go into them all. I do want to point out here, right, involvement in extracurricular activities reduced withdrawal by 12%. We're talking, right, a lot of this stuff is not rocket science, right? I think sometimes in our own profession we get too complex. And we have over elaborate types of theories that we begin to try to implement when we don't necessarily have to. And we need to get back to some of these basic things, which is about creating human connection. Right? Extracurricular activities reduce withdrawal by 12%, right? It's amazing, right? And then this notion of academic distress, right? This becomes a big piece, which means we need to get in there early, right, before it becomes overwhelming for the students. I was working with this one student who was a music performance person, trumpet, brilliant, super smart, and she would come in at the beginning of the semester, right? And things would be going okay. They'd be going, right? Tough major, hard worker, right? You know, some friends. There was one friend that was off campus that was not necessarily good for her, right? And like clockwork, by mid-semester, she'd be in complete and utter shambles, right? To the point where the SI kicks up, right? The point of, you know, constantly walking down. Unfortunately, Pittsburgh has a lot of bridges, and so a lot of students want to walk towards the bridges, right? And it would just be this, you could see it coming, right? And it was like, and the academic kind of distress would take over and it would crumble this individual. And so the work was changing this cycle, but also getting at the academic distress. Right? And what were those points that were pushing this individual over the edge? One being perfectionist, right? And always wanting to perform at such a high level, right? We had to look at other parts of her life that were just as important, i.e. for her, social relationships. When the social relationships were better, the academic distress, when she took more of a proactive approach to her well-being, sleep, all of these different things, less academic distress. But it was a training that we needed to do, and what was available for her became really important. So it could become a protective factor when we got that distress down. Okay. This part right here, as counseling centers, right? We're working with both mental health issues and non-mental health issues. Right? Again, this is where I'll talk about the therapeutics come into play, because there's a lot of things we can do that don't need a therapist, right? That's going to help us out, okay? So, right, we need to strengthen all of their local eye, which means we have to look at the environment. we're good on clinical load index. I'm just going to skip on over that. Okay. Now, I want to bring in this because this becomes really important. Is anybody familiar with the Mary Christie Institute? If not, some of you have, this is great because, again, administration, right? These are what presidents of universities are talking about that we can use to our advantage, okay? So there's about 115 or so college presidents from a variety of institutional sizes, right, that respond to this survey, okay? So it talks about, they just met this March. Actually, they're meeting this month for another one. So this was from a few months ago. These are the things, right, that you're all familiar with Gen Z students, right? Increased stress, depression, anxiety, right? What influences social media use, right? No shocker, okay? Right? Academic, extracurricular, right? So you see the pattern. Everyone's starting to see the same thing. Economic anxieties, parenting influences, right? Social political stresses over the last 5 to 6 years, right? The tribalism that's beginning to take place, racial trauma as well. These are all things that are influencing the Gen Z students. One of the things that they talked about at their last conference, which I thought was fascinating, and again, this is the trajectory, was this notion of flourishing. People in here, Seligman, right? Positive psychology, right? And well-being, that we got to start paying attention to this. And this fits into this notion of well-being. Creating courses and classes, right, that are really talking about the whole person, right? So flourishing as this kind of North Star, right? And so it's a different way of looking at it, and it's more about promotion, okay? So these are things that, again, presidents are starting to talk about. And we're starting to get more data as well to back up what we're doing. Okay? And again, they like these different kind of courses, right? When you're looking at, improved intentional skills, social emotional skills, right? It's almost like we're continuing from what we were supposed to be doing in K through 12, right? The social emotional learning aspect, right? Not to mention right now, we're having a lag here because of COVID as well, right? So we got kind of a 2-year type gap in emotional development as well coming into our colleges and universities that we have to address, okay? Big ones like compassion and empathy, right, all become a part of this, okay? So this just talks about some of the campuses that have had courses and what they're seeing from their students, right? So decreased depression and the different type of improvements they're having from doing these courses. Wouldn't it be fantastic if every university and college had a core class on well-being? Right? Yeah. And think about it, right? And how many of those students from that then won't show up knocking on your door? That would be a great thing. Another piece here that they looked at too is so that college experience, what they're learning and how that affects lifelong and employment afterwards, right? So again, having these different kind of courses, beginning to look at, graduates who reported below experiences, right here, right, were twice as likely to report levels of well-being and engagement later in life, right? So having someone care for me as a person, again, not rocket science, right? Mentoring opportunities. Activities in the classroom that are linked to real-world problem solving. Okay? Okay. Now, this is not adverse childhood experiences. This is the American Council on Education. And this is the survey they sent out to, this is part of the Mary Institute as well, and this is the survey that they use. And so this slide here is really, I think, important and stuff that you can take back to your colleges as well, right? It's been pretty consistent over the years, right? That mental health for students at 68%, it was 73, right, is a big one, okay? They're starting to talk about it, okay? Now here's the other big concerns, enrollment numbers, right? Economics are a big part of it. But here are some new ones that haven't been around that are just as important. Morale of faculty and staff, and retaining faculty and staff as well, and mental health of faculty and staff, right? And so again, we have to think about pathways, and again, it's not necessarily your job of the CAPS department, but it is because people are coming to you for answers, right? And again, this is another avenue, right, for faculty and staff mental health that you can leverage technology to, right? Apps that are available, right, to give the support that the faculty and staff need for their own well-being, but also skill sets when they're in the classroom when it comes to how to recognize a student in distress, right? How to do a referral. How many calls do you get from different professors and they're like, you have to see this student right now. And then you have the conversation with them and they bring them over, right? Everything, and you're like, okay, yeah, I know this student is in tears, right? And they feel they can't function, but it's not a crisis. But now we got all of our staff in here, right? And because they didn't know, right, what kind of questions to ask and how to make that assessment. And so we can do that oftentimes through, apps too, different types of trainings that we can do for our faculty and staff, right? Or how to send out an email that is empathetic, right? Has a little bit of care in it as well, right? It goes a long ways, right? We knew from the last slide when it comes to, right, someone that cared for me is super important. I'm not just a number, okay? Any questions when it comes to this report coming through? Okay. I'm just going to throw these up, and you all seen these? Right? So I think the pandemic brought up a lot of, kind of those base level things on Maslow's hierarchy of needs that we needed to start paying attention to, right? That we're becoming that we got to get that first, right? Housing, food, different things before we're even thinking about other things, right? That became part of our job. Baseline suicidal ideation shot up since of the acuity level coming in. Okay. Distrust in their own happiness, okay? Anxiety about social relationships. We heard that yesterday from Dr. Schofield, right? The social part, the social anxiety is huge, okay? Physically there, but mentally not there, right? My wife is a professor of sociology all the time. Students are there, but they're not really there, right? They've kind of checked out. Okay. And again, increases in sexual assault as well are all these things that again, are part of, I think, pandemic related. Okay. Okay. Since 2016, percentage of students triaged at Duquesne has gone up 384%. Is that consistent with other people in the room? Yeah? Right? 384%. Right? We can't keep doing the same things. It's not sustainable. We have to begin to rethink, and it can't just be the counseling center, the CAPS department. It's impossible, right? I was having some conversations with some of you the other day, right? And if something goes awry in the university or a student hurts themselves or there's a threat, right? It's on us. Well, why didn't you know about this student? Well, I don't know. There's 15,000 students, right? I don't have the interaction of all of them, right? And I don't have a crystal ball, right? So again, we have to come up with a way. We need a paradigm shift. And this is exactly, I think, what Dr. Schofield was also saying, right? That we need to rethink, right? Not the quantity of people that we see, right? That absorption model. But the new frame is what type of care can we provide our students, right? And if you looked at that clinical load index, right? When you have more space and time to see that student with a higher acuity level on a weekly basis, they get better and they're retained. They stay at the university, right? And it's been my experience where at Duquesne, right? my schedule would fill up by midterm every year. And then that student, right, who's had a severe trauma history, or the student that's struggling with bipolar, gets pushed to being seen biweekly and sometimes every third week, so that, no offense here, right, I could see the student that was having difficulties from their sorority, right? It's needed, but it didn't need a therapist, right? We needed another way for that person to be kind of intervened at. So this is the paradigm shift, right? And so talking about my experience, right, people familiar with Bronfenbrenner's bioecological model, right? It's really fantastic, right? Because it begins to look at all the different settings an individual fits into and the influences it has on their development, right? And the more close they are in the sense of the micro systems, right? So if they're living on campus or if you're in a community college, right, that micro is also home, right? Because they're commuters and those come into play, and how that feeds into one's worldview, right? And then as we go out, right, the distal, right, they still impact you, but on different ways, okay? And this model is great at recognizing and identifying what are the protective and risk factors in each of these ecosystems, right? Whether it's in the micro, right, whether it's in the macro, and whether it's in the ESO as well, right, in the wider community, okay? Now, one thing that I've been thinking about, and I'll give it to you here for free, and if anybody takes it on, just give me a little bit of a shout out. This model right now is incomplete and it's a bit dated, right? This Yuri Bronfenbrenner, it was designed in 1972, right? It's been updated a little, but there's a huge area that's not really listed overtly that needs to be, and that's the digital space. Right? When you think about it, right, this digital space is now part of the micro at your fingertips, but it's also part of the macro at the same time. Because that person who likes you or that might be on the other side of the country. And we need a way to fit that in here as part of this in a development, because TikTok, right? We're talking a very young age. People are getting hooked, and that's part of their identity formation is now this new way. Right? So if anybody wants to, I think, right, we need to update this with the digital space as part of one of these major systems. Okay. Any questions about Bronfenbrenner's? Okay. Again, it's a switch from being reactive oftentimes, right, of students coming into the consultation room, right, and talking to us and getting out and promoting a lifestyle, promoting a way of being, right? So eudaimonia, right? I think it took me 3 years potentially to pronounce it. I think I pronounced it all right. But again, so Aristotle, right? And again, this is such an important word because happiness does not do it, right? Because happiness is a state and it can be fleeting. And a lot of students that I'd see would always come in I just want to be happy. Let's talk about that more because there's so much more into that. It's not just about being cheerful, right? But it's a way of kind of life, right? It's a pursuit, right, that we're trying to get to that's going to have those ups and downs and difficult emotions that we have to begin to work through, right? And so really this is our promotion. This is our idea of what we're talking about with well-being is that it's a holistic approach, right? It's a mind, body, spirit. We have to be looking at all of them, and we have to educate our students as well to pay attention to these different parts of themselves. Because oftentimes when they're coming in, they're just looking at it from the academic part in their courses, but they might be forgetting all about their spiritual side of themselves or meditation. And that becomes really important in their formation. Or their physical health, right? That becomes important, okay? And the other thing I want to point out with this kind of definition here of well-being is the socialness, the connectedness to the world as well. Can that individual, right, be an active participant in their community, right? Whether it's going to work, right, whatever it is, their skills and talents, right? Do they have those basic needs to reach their potential? That becomes part of this promotion of well-being. Any questions about well-being here? changing cultural norms. This is going to be the hardest lift of the whole thing when we're talking about creating kind of this more integrated approach, because we've destigmatized mental health, right, in many, many ways here, right? And this is not the case across all different types of demographics and communities, right? So depending, you might be first-generation student, might be different racial and ethnic backgrounds where there still is a lot of stigma, right? It hasn't gone away that we have to begin to address, right? But this idea of, I got something going on in my life, right? It's a really tough kind of emotion, right? It's my first breakup or whatever. My life is crumbling. I have to talk to a therapist, right? And this would be my experience as a therapist. Student would come in. It's like, gosh, I was dating him, and it was in high school, right? And now I'm in college, and we were going to get married, and we had all these different things, and now we're not, and I don't know what to do. And it's like, okay, well, it's fine. I think it would be helpful, right? We have these other kind of resources for you available that would be really helpful to kind of work through this. Maybe one of our support groups, no, I want to see you, right? I want to see you. No, I don't want to do that. People have that experience? And again, that customer service, and so then you're like, oh my, okay, I guess I could, I don't want this person to be left on their side, right? But it's also a shift, right? So I have that idea of an ankle sprain because it's so important. When we go see the doctor and our ankle is sprained, and would we find ourselves saying, doc, I know it's just kind of sprained, but you know what? I think I need surgery. I need something more intensive to take care of this, right? But no, you don't. No, I think you're wrong. Yeah, that's what I want, right? This is the shift we have to do in our profession as well, right? To make some more of these kind of boundaries as well, in a sense of what is actually going to be best for the client, the student in general, even though they want it, right? Okay, so again, the shift from this kind of customer service oriented to more of a consultation approach, right? We have to do a better job as therapists of selling this to students. And it's super hard, right? Students that come in, we talk a lot about social anxiety, right? And that's the hardest one because you know what's going to be best for that student who's really struggling with social anxiety? It's the group, right? It's the group because they can mirror in that, but they're scared to death to go into it, right? And you really have to do a good job of selling it to them and easing their anxiety because that's what's going to be best for them, right? So as therapists, we have to really get into it. And it's also difficult, and I know if Ian was here as well, right? Your team, you're going to have varying degrees of individuals that are going to buy into this idea of the therapeutics as kind of the first part rather than kind of secondary because we have bleeding hearts, right? Bleeding hearts, right? Which is not a bad thing, it's just that we can't keep going in that direction. We're going to get burnt out or we can't see all the students that we need to, okay? So also the fact that when we promote more of these therapeutics that are out in, right, and I'll take a deeper dive in the sense of what we mean by therapeutics, it promotes a well-being and it's more long-lasting. And why do you think that is? Because people have to be active. They have to start doing things to make these changes rather than being passive recipients. And that happens in therapy, right? Passive recipients of that information, it feels good, but there's no real kind of lifestyle change. It becomes almost like diet culture. Yeah, it works fine when they're in therapy and then they're out and everything kind of goes back because it hasn't been a lifestyle change. That's what we're trying to begin to promote here. Okay? So when we think about this, these are kind of our 10 core beliefs. And looking at Dr. Edwards and myself that we kind of came up with that are kind of the foundation for this integrated model of care here. No one should have to wait for psychological care, right? No one. Now, to do that, we can't keep this current system because by mid-semester, there's no more room in the inn, right? So we're going to have to find other ways to promote it, right? So they get the psychological care, and it doesn't have to be one-to-one therapy or group therapy, okay? Right? There's different levels. You're all familiar with step care, right? This is what we have to begin to do as well, or we call them levels, right? Where an individual grows. And so it depends on that initial assessment of that student or individual. Okay. Number 3, and I think it's underplayed, right, is we want the individual, they have to participate, right? And this is the big one because oftentimes, right, it comes down to motivation. How do we motivate our clients to act, right? And so, anybody familiar with the FOG behavioral model? If you haven't, it's very, 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 very cool because it really kind of looks at what are those core motivating factors for a human, right? And this is really important because ideas of what keep people from doing actions, right, that are even good for them, right? We don't like pain, right? We try to avoid pain at all times, rather than actually what's best to me is kind of to lean into it, right? But that's hard, right? This idea of we want to seek hope, but we want to avoid fear, right? It is the age of anxiety, right? There's fear all over the place, right? Because they're like, I want something more concrete. So again, how do we avoid fear? And this notion of seeking social acceptance while avoiding social rejection, right? Social media, right? Prominent, and then that plays out in the one-to-one, right? So when we think about that, we can start to then see the individual and like, how do we begin to counter it and lay that framework for one to feel competent to act? And that's another piece why we have these kind of core motivators, but also in a couple of slides down, when we talk more about Oasis's chat support, it's based in motivational interviewing because it helps students get to that point where there can be some ambivalence, right? Tension between two ways of being and being competent to act, right? So, and the other thing I want to point out here for participation is, and especially in an academic setting, right, is we're constantly talking about, well, you just need to work all the time, right? You just got to work through what you're doing, right, and it'll come. And we're not looking at the different levels of motivation that you go through on a daily basis. For example, I'm kind of a procrastinator. That's because I don't have enough kind of energy. If it's 3 or 4 weeks out, I can sit down, but I'm not going to be productive, right? I have less energy to kind of focus. I need something that's a little bit more immediate to bring that up. And so the FOG model here talks more about there's waves of motivation that happen all the time. And it's about teaching individuals to recognize when there's high motivation to do something, you do hard things. You do the difficult tasks that are ahead of you, right? And maybe that difficult task is, all right, today I'm leaving my room and I'm actually going to the dining hall to eat. That's the hard thing I'm going to do, right? And that becomes important because you have the energy, you have the motivation. Whereas when the motivation is low, right, do easier things. You're still active, but you do easier things. And this is what we can begin to teach our students as well, right, going forward. And again, not rocket science. Okay? Therapy versus therapeutics, okay? Because again, we say, well, therapeutics, well, that's therapy. Yes, therapy is therapeutic for the individual. But here is the big difference that we're talking about between therapy and therapeutics, is this established clinical relationship, right? When they come in, right, there's a form, right? You're engaging into that kind of patient-therapist kind of role. That's therapy, okay? Therapeutics, on the other hand, right, can be any activity that has some type of therapeutic benefit. That could be going for a walk. It could be listening to music to ease your mind. It could be strength training, right? It could be reading a book, right? It could be using chat support, right? It could be going to a mentor, talking to a professor, right? Learning a new skill. Anything that is out there in your environment that affects your mind, body, or spirit can become therapeutic, right? And by engaging in these ones, again, it can have more lasting effect because you have to have the individual participating in it. They become active rather than stagnant. In many ways, we've become so passive, right? On demand, I can click, I don't even, my kids are like, what's a commercial? What do you mean? You can't pause it? But it doesn't make any sense. It's just there, right? Or the internet, or right? It kind of comes through, right? A lot of my professor friends as well, there's this passive learning that happens that it's not good. It's more of an active approach to be more analytical. These things become really important in our own kind of development. So, therapy versus therapeutics. Any questions there? Number 5, the vast majority of students who seek psychological care don't need therapy, traditionally. Now, I hope that Dr. Schofield, right, would actually start to research this. And we could come in and actually see, in a sense, the assessment, the students that come in that actually meet a level for a clinical intervention. In my experience, and also Dr. Edberg's experience over the last 10, 15 years, that hasn't been the case. Is that potentially consistent with people here in this room? Yeah? No? Most of the students that you see need it? Yeah. So that's also going to be dependent on your environment as well. I was talking to some folks in a sense of who worked at a community college and a lot of first generation. That's not the case. People who were coming in needed it because it was already at the tail end before they reached out. Right? So recognizing what your environment is does become important. Right? So where your institution stands too. Okay. Participation is based on the acuity level and readiness for therapy. Right? This becomes an important piece as well. Is that individual, they might meet the threshold, but they're actually not ready for therapy. They need those skills, right, to have more self-awareness, to take a deeper dive and reflection and sense of what's going to really be effective in therapy. And so there's things that we can do before they get into that therapeutic relationship that also become important, okay? So again, this is usually done, right, in that triage piece or the clinical interview, right, to really see where that student is at. Right now, and especially at Duquesne, it's a lot based on the therapist's interpretation right now. We would like to come up more with kind of an assessment here that could be used more broadly. We just don't have it yet. That would be based on, the readiness for it, how they're able to kind of think about their emotions and articulate it, and the acuity level, and without being like 50 questions. So that's what we're kind of working towards in the future. Step models can be confused as if you kind of just go up, right? So if you've already reached kind of like, I need a therapeutic intervention, that's where you stay. No, we believe it's always fluid. An individual can go back and forth between these different areas in sense of what they need for their support, okay? And again, I'll be taking a deeper dive into each one of these as well. For growth to occur, right, practice is essential, right? Cross-training. And cross-training means all those different parts of our well-being we begin to focus on. There is so much more information right now when it comes to strength training that wasn't out there before, in a sense of, especially for depression, identity formation, body image, right? And just even the differences in a sense of our neurons and firings as well. So I'm really excited about what's coming forth when it comes to different parts, right? Meditation, and I'm not just talking about mindfulness, right? Mindfulness is great and fantastic, but it's not an end-all. Right? There are other ways, depending on the student as well, right? It might be a faith tradition or prayer is different that might work for them that we also need to be promoting. Okay? So cross-training. And then number 9, right? Maps of meaning. This becomes super important, right? How does that person view the world? How do they view themselves in the world? Purpose, right? And then when I'm out on a Friday or Saturday night, is that congruent with how I see myself, my morals and ethics as well? right? Because these things, right, we need to take the time to build up because that is also going to direct them to be motivated to act, right? Why else would you like do a dissertation? It's ridiculous, right? Unless there's some motivating or purpose and end that drives you to do it, right? Otherwise, it's just crazy, right? You know, or different things that you might put yourself through, right? So these maps of meaning become really important to really kind of be a foundation for student thriving. And finally, it's a promotion, right? We're trying to change culture, right? So that means we're trying to really educate the whole campus community, right? And a recognition of what we talked about, right? Every student and professor is nested in multiple environments, right? And so how do we affect those environments? How do we increase these protective factors? All right, so here you go. This is kind of what we have in a sense of, kind of 10 points, right? And again, this is going to potentially look different for any campus. These are jumping off points for you, okay, going forward. So steps, levels of care, again, I think foundationally to all of this is establishing care points, and I'm going to talk about this in just a second. And then we got 2 through 8, right, that are the therapeutics. Again, we haven't gotten to the clinical side yet. And then the last 2 is therapy, because this is going to give you the best time and quality of care for these students. And then you can see that it can go up and down as well. Okay. This is probably going to take your most time, right? Because this is about getting out. This is getting out and talking to your key stakeholders at your universities, right? So when we think about, right, those major areas that students interact with, each one of those touch points becomes a care point, right? So in our work, and especially even with Oasis and working with Duquesne, right, we need to be engaged with faculty and staff. Sometimes that comes through the provost's office. Sometimes it comes, with academic advisors. We need access to the true frontline individuals, which are the RAs, right? Who are also students themselves. RAs, RDs, and different type of staff that are on campus as well. Right? So we look at that and we create that and we're sharing the information of here are the resources on campus to give your students. Right? That creates more and more buy-in. But again, this is going to be the hardest part because it takes some time to establish credibility sometimes. Right? You need to think about who are your major influencers on campus? Who holds weight, right? You need to get them as allies, right? To go forward. And right? There's different silos. And if you don't have the right influences, you're never getting into that one, right? So you got to kind of pick and choose those social networks and begin to engage them and create allies here. Okay? The other part, informational care, right? So this is how do you get your information? How do you get out your awareness campaigns, right? I love the Center for Suicide Prevention. They do the Seize the Awkward campaign. Have you seen those? It's been fantastic, right? Because how do you have the conversations with a friend who might be having some SI? It's brilliant. It's really good, right? Or Send Silence Packing, right, on campus. Out of the Darkness Watch. So there's a lot of different ways we can begin to create conversations, right? How do we use... do your schools have like a local TV station or something like that? Or there's different signage that you can begin to kind of tap into? Centers for student involvement, right? All of these different ways. How can you also leverage technology in a way that's going to promote your awareness? Okay? So informational care. Get involved, get moving. Right? Again, not rocket science here, right? But getting students over to the gym. Running, taking a group class, whatever I mean. Again, you're creating social connection, but they're also feeling better about themselves, right? So we've partnered with the rec center, and so students might be afraid of the equipment. So we've set it up where they can have a one-on-one with one of the trainers over there in a way to really learn how to use the equipment, right? Learn about the different types of courses. And to be honest with you, if you want to look at Duquesne, the most used space on campus, by over 50% of the population, it's the rec center, right? That is the place, right, to influence, okay? So you have that part. Also, your centers for student involvement, right? The different types of groups that they can be in, right? It's an anime club, right? It's a ski club, right? Whatever. Those type of things become really important because we want to get students out of their room, right? Engaged, okay? Number 4, interactive and on-demand care. So we got something like a 24/7 chat support, right? It's on demand, that's where they live, right? The other parts you have that you can do that are interactive, right? People have biofeedback in their counseling centers, right? Again, another way to teaching individuals that they can really take active control in their body and learning how to decrease their heart rate when they're stressed, right? There's different types of games and all sorts of stuff that can be used there. And then also we have the newer kind of VR technology that is out there. Now that's a different lift because it depends on what your resources are. Duquesne did not have the resources to get the VR technology, right? But biofeedback, I think, is much more affordable. And a colleague of mine actually would just do it in sessions sometimes with a pulse ox on a student's finger and do different techniques with them so they can see in real time, right? Reducing that. So it can be even lower tech as well, right? So again, interactive and on-demand care. And there's countless others that you can begin to think about. Peer supports, right? These are, the research out there is exponentially in favor of peer supports and what they can do for individuals, right? So Active Minds, Girl Gains, it's a newer, cooler group out there that is weightlifting for girls, right? And it started out in the University of San Diego, I believe, right? And it's kind of gone across the country, and it's been fantastic. Different types of peer supports groups that you have. I imagine there are other peer supports out there that people have.
Some that are specifically for BIPOC.
So BIPOC, yep, great. Others? Any other out there, or any other? Another one that Duquesne uses. They have well-being educators. So it's another student that is kind of trained, and then again, it's right below that kind of clinical intervention piece. Okay. Here's your therapeutic support groups. So this would be more of, again, students getting together, but there's more of an intentional focus, right, that would come to it. And it's more and more important, right, to have men and women groups. Men, it's, we were on top, for so long, and it's good, right? But now I think guys are getting lost. They in many ways don't know what to do, right? And so there needs to be a nice kind of way of, again, bringing them together to talk through different things, but not to be the focus of everything either. So again, it's a tightrope, okay? Skills development, right? So seminars and workshops, right? Again, this is about a cell as well, right? So communication skills, right? How to do better test taking, right? The anxiety type pieces. Do other groups offering any workshops or seminars in your schools? Such as? Sleep? Yeah, sleep. Huge, right? We don't think about it, but sleep in college is huge. Yeah, others? Were you going to say? Yes, exactly. Managing academic stress, right? These all, right, become important, right? And you can have larger groups, right? They're learning a skill set, right, that is going to, again, foster well-being, right? And then this idea of increasing soft skills, okay, become really important. Different seminars that we can do. And again, these seminars can be in person or they can also be online. All right. One of your other hardest lifts is inside your CAPS or counseling center, okay? This notion of almost kind of a retraining of us, right? In a sense of our work and really assessing for those things that we talked about before, right? Readiness for therapy, acuity level of the presenting issues, right? And as a first step, promoting the therapeutics on the campus, right? That becomes the big part to do, right? The training piece. Okay. So that therapeutics intervention become the first option, not the second, right? This was a big shift for me, right? And especially when you're, especially when you're new and kind of coming out, it's just like, you want to make sure the client's happy all the time, right? And that's not always what's best for them, right? So the shift is not going into one-on-one therapy or the group therapy. The shift is we're going to do therapeutics first. That's going to be our offer, right? I will tell you, at Duquesne in the spring semester, where it's been implemented, Dr. Edwards, right, said, okay, so we're going to have, every therapist is going to have 4 30-minute consultations on their schedule, right? Laid out all the time for new students. Checking for kind of a acuity level and offering therapeutics first for those individuals, right? It's now mid-semester. And he said, I looked on Titanium. They still have openings to see students. Whereas in the past, every therapist had been full at this point in time, right? So this kind of shift to, again, this promotion of the therapeutics as first, right? Again, looking at acuity to make sure those individuals that need to be seen are there has, at this point in time, and it hasn't happened over the last 6 years, they have openings where if a student calls, they can be seen the next day, right? So again, this has just started. This is semester. It's early information, but that's pretty telling. Okay. Again, there's engagement, right, of using these different things that are available to you, right? So you have technology like Oasis, right? You got psychoeducation, you got support chat, right? These are things that are available on demand for the student that they can begin to use in real time. And as a therapist, you are the influencer. You are. You hold a lot of power, right? And so what you offer them becomes really important, right? And they're usually going to take your advice, not all the time, right? But they usually are. Okay. You can also use support chat as kind of a virtual walk-in as well, right? So you might have a smaller staff or you're all just overwhelmed. You could also use the chat support in that way. Okay. The other part too, again, when we think about leveraging technology within our CAPS departments, right? I'm going to be dead honest with you. Can I be dead honest with you? Transparent? So a lot of technology in the space. What's the utilization? What's the engagement of those tech? 2%, 3%, 4%, right? Those are not necessarily great numbers. Timely MD, 4%. A lot of places are, okay? Now, for it to work, and what we've been doing at Duquesne and our other partner institutions, right, it has to become part of your ecosystem. It can't just be an add-on because you're not going to get the engagement, you're not going to get your return on investment. And so that's why we really work within your CAPS departments, but also other entities at your universities to have those conversations and how you can use it and to offer your students. Okay, and I'll show you some stats a little bit later on where we're at. But that's where you kind of get the buy-in, and that's where you're going to see the gains of leveraging technology. If it's just something that you purchase there and it's not well delivered, it's going to fail. Okay. Or I should say, it's not going to fail. It's going to be a good offering, right? But it's going to be underutilized. Okay? It has to be more of this integrated approach, right? Technology is a piece of it, not all of it. So now we're getting into basically therapy, right? So the acuity level's there, right? So your 9 and 10, right, is the best option. Now you're thinking about what is it? Does this student need long-time care? Actually, can we do this at our center, right? Do we have the capability, or do they need, an IOP, right, or something that's outside of the university where that student needs to be referred? And then, of course, 10, we're looking at the crisis care, right? So triage or hospitalization would be on that upper level of care. Okay. So here you go, right? So the bottom part, creating and establishing care points. Then we have those therapeutics, right, that come across, right? 2 through 8, and then ultimately therapy is those steps 8 to 10. You're going to see a crossover between number 8, because when that student comes in your CAPS department, they need therapy, and you start it. Or they need to be shifted towards kind of these therapeutic interventions, right? And by doing this, right, you're going to open up your time to see the students with the high acuity level and to do your work, right? That's what we want to do here, right? I wanted more time to see those students because I know I could do much better job with them in a sense of that healing if I could see them on a weekly basis. And we saw that yesterday when you look at Dr. Schofield, right? When you had that quality of care, right, where you had more time to meet with them, and some of them is 6 sessions, or it might be 15 sessions, or it might be over the 4 years that they needed it, right? But you retain them and their anxiety or depression or whatever it was lessened when you had the time. And that's really what we're trying to do with this approach. Any questions here? I know I'm just kind of going. So I just want to do, because I'm going to get some time for some questions here too as well. Just want to talk about what the support chat is, right? And this is where it becomes important, right? Because when someone struggles with something or done with, there's going to be a certain amount of anxiety or stress. Eustress, right? Which is good. Yet, if that person doesn't have the resources, then that eustress, right, to action can flip over to distress, right? And then they're calling, right? But if we can get towards that person, right, in a sense of where they're at and that trigger point, right, where that stress is happening, we can offer that support, right? So we can use chat support as a pre, where students that actually need some more skill sets to enter into therapy. You could also use it as during therapy, as an adjunct to therapy, because oftentimes we do lots of great work with the students, and then we send them out, and then they come back, hey, did you do any of those suggestions we talked about? No. But if they have resources where they could be checking in with someone is responsible, right, they actually could, and I'm going to give you an example here. It's on another slide, but I'll just talk about it here. We had a student who was in therapy. They were struggling with a lot of body image type issues. And so they were working really hard, right, when it came to their diet and their exercise, right, their own kind of image of themselves. So this particular student who was in therapy used chat support in those times when that motivation was lower, right, or to talk about their successes of, hey, you know, I lost this weight here, I didn't binge and purge here, right? It was that person in between that they could do at any time to reach out to. It's someone to validate their experience, and it made the therapy much more effective, right? Because it was someone kind of boots on the ground to be there. Or it could even be post-support, right, to maintain their well-being over time after therapy. Okay. Oop. Wouldn't that be something? I just turned off the whole thing and be like, right? We also, as I said before, we use motivational interviewing and person-centered communication. How many people are familiar with motivational interviewing in the room? So pretty much everybody, right? So I'm going to go through this really quickly there. I'm just going to, because you're already kind of in it, and we'll get to the results here because time is starting to go, right? This big part here of motivational for me is so important, right, is this motivation and ambivalence, right? So this tension of an individual, right, has to want something, but at the same time, not sure if they want to do it, right? You know, I know I probably shouldn't be vaping as much anymore, right? But gosh, it's here, not so sure. I know this relationship's not great for me, but I don't know what else to do, right? So I need to get out of it, but I can't, right? And so motivational learning is really good, right, in a sense of what they're doing to help that person understand that ambivalence and get them to the other side to feel confident to make those changes, right? And support kind of that change talk, right? You know, and when I think about ambivalence, you know, oftentimes This is something from Alex Waite and Nicole Luhanic, who have really been instrumental, right, when it comes to putting together our kind of MI chat support kind of foundation, right, and going forward. I was in Portland some time ago, and it's probably like 19 years of age. And if you're in Portland, just outside of Portland, there's this like river, and then there's these rocks, right, that have like cliffs, and like people jump off of them. And then when you're sitting down below, right, and you're looking like, oh, that's not so far. That looks like a lot of fun, right? And you're like, that's super cool. So you're like, oh yeah, I'm going to go and do that. And then you go up there, and then you get up on the rock, and you went, oh, whoa, that's kind of high. I don't think I want to necessarily go off of that, right? Because it's totally different from up here than it was down here, right? So I wanted to, but at the same time, once I got to it, I didn't know if I could do it, right? And that's oftentimes with our students, that's when we struggle, right? Those stresses, right? We want to, but it'll be a lot longer, right? Or when you're stressed out, when you're in it, it becomes more difficult. And that's where motivational learning really is helpful, right? Because of the supported language, the person-centered language that is used to get that person to some change talk. So a little bit of Duquesne by the numbers here. So this is since August 22, right? So you look at that and you're like, oh, it's not good. It's a really good number. In a sense, if we have just started, right, in a sense of the student kind of download rate, right, is almost at 11%, right? And so this is where we are going to continue to work with, our partners, right, to really make it more pervasive. And it's much better than a lot of other tech out right now, which is like 3 or 4% engagement rate, okay? Now, this is the chat support. So as part of that, there's also a crisis page, right? So there's average of 10 students that are engaging that crisis page. And these are students probably that you didn't see at your counseling center, right? But they're engaging it, which means it's another layer of support and safety net for your students at their fingertips. We've also had 255 completed chats since that time as well, right? So again, that's potentially 255 sessions that you didn't have to put on your schedule. Right? These are the top topics, right? Again, we're talking about therapeutics here. They don't need a clinical intervention, right? Relationships, academics, and anxiety. And what I want to point out here that's really interesting, so these are our top topics that are rated on the chat. They mirror what the therapists are seeing in the counseling center, these topics. These are the top topics. So think about it, right? How much of this could then be used in other ways in the sense of therapeutics to address these issues, right? And this is what we're really proud about, right? So every student who gets onto chat, we ask them a scaling question of 1 to 10 in the sense of where their stress is at. On average, we're seeing a drop by 2.7%. So again, academic stress and these stressors, right, main things for students. If we can lessen that for them, we're going to not only retain those students, but they're able to reach their potential, right? They're going to be less likely of reaching out to you. Okay. So again, I'm running short on time, so these are just different case examples of students who have called in, but I'm going to forego that so we can talk more about the feedback we've gotten. So Dr. Edwards has kind of done a convenience sample of students. And we asked some of these particular questions, all related to kind of their own sense of self, their well-being, what contributed, right, or hindered their kind of academic performance, types of well-being practices that they did, just to kind of give the lay of the land of what's been going on, right? How their well-being practices have also influenced retaining them at the university, okay? And so I want to show kind of some thematic findings that we have that are really important, right, that we can begin to right? So well-being as a way of life and perspective taking. How much of our work we do, right, is about perspective taking and teaching students to learn about the different perspectives they have, right? And how we view the world or people around us has a great effect on who we are. For example, we've been talking a lot about social anxiety. If each person I see and I look at and engage and I see you as a threat, right? It's really hard because that's my perspective. how do I begin, right? Maybe it's some polyvagal kind of theory here, right? To lessen what that is, right? It's about perspective. And so here are some of those things that are talking about, hey, when I think about the big picture rather than an individual experience. Back in ninth grade, I gave that presentation and I froze. Words just were not there, and that's going to happen every time now. That's the perspective. That's the lens that I view all time until I have a corrective experience, right? How I look at the big picture, right? You're entitled to have a bad day, and these are some quotes from the students, right? How profound is that? You're entitled to have a bad day, right? I tell my wife that, but it doesn't always work. I realize that I'm better in getting through difficult things than I thought. This is another big piece, right? Some of this grit and resiliency building that we need. Okay? This idea, there's no moment of complete well-being, very profound, right? It's a trajectory, it's a way of life. Happiness is a side effect, not a destination. It's a pretty smart kid. I have to get out of my own way. Right? These are really good kind of life skills. Okay? The importance of routine and locus of control. Part of this work in this integrative care, talking more about therapeutics, is the importance of routine. So we talked about sleep hygiene, right? That's about a routine that becomes important. If you're staying up and doing video games and one night it's 3, 4 a.m. and then the next night you're trying to hear it and you're all over the place, it's hard, right? Right? I don't want to go to the gym or I don't want to work out on a daily basis, but I know what the benefits are. And that's what keeps me going, right? And this notion of control, right? Understanding there's things out there that I can't control. And I got to be okay with it, right? I can't control if I have a student who comes up to me and they're really pissed off at me, right? I can control myself, or I got a student who's super, super anxious. I don't have to take on their anxiety. Right? I can put it to the side there. So how we understand, especially with social media, right? Who are the influencers when you get clicks or you don't get clicks, right? Your life is kind of controlled sometimes by those likes. So again, this more of an internal locus of control becomes important, right? This idea, I've become a lot more confident when I stop comparing myself to other people. Okay. The other part, self-care. Right? And I would like to change, this is a part of self-care, but I'd like to look more at community care as well, because self-care, we've always put so much, has to be our own all the time, but it's a community. So community care, brackets there, and the importance when students when they put it on doing their own well-being practices, their academics improve, right? They make some choices for themselves, not just based on their friends or what other people want. Okay. I have to do something to make it better, right? Again, active, encouraging people to be active. Big one, sense of belonging, which equates to retention, right? The research is conclusive, right? When students feel like they belong at the end of the student, they're more than likely going to stay, unless there's some extra, history of hospitalization that we saw yesterday, psychotic, a few different things that come into play. Okay? So well-being enables me to see the paths that are available rather than what's not available, what's blocked from me. Okay? Being involved, right? Those extracurricular activities, right? Being involved of a member or club, right? All of the things that, universities have a ton of these, most of them, right? Of different ways that students can be involved, and so we promote those. Okay? It takes a village to be happy. I am the me that I want to be. It's a cool saying. Okay. And again, this idea of therapeutic cross-training, right? These individuals saw, right, the importance of doing different things for themselves, right? Exercise, strength training, right? Meditative practices, reading or podcasts that were for themselves, right? It was a proactive step for themselves. Okay. Weightlifting has taught me that hard work pays off in the end. That's true, right? When you get in there, right, and you're lifting different types of weights and it's hard, you then teach yourself that you can handle stuff out there that's hard as well. Okay. Doing the work at times makes me feel uncomfortable. It's hard work, but it's easier than if you don't do it. All right, that's it, right? It's easier if you don't do it. When I let my physical health go, my mental health went down as well. Okay. The importance of establishing discipline. I don't think we talk about this enough, right? You've got to have a certain amount of discipline as well, in a sense of academics, but also just sense of self that we want to begin to instill. Okay, because oftentimes when that motivation is low, that's where the discipline kicks in, and you do it because in the long run you know that it's important, right? It's that student who comes to you, right, and it's 6 weeks into the course and they're all stressed out and like, when was the last time you went to that class? September 1st. Well, yeah, it's no wonder things aren't going right. What's kind of the discipline that they've had? Okay. And then, of course, campus resources, right? Utilizing those resources that are available on your campus become really important. Okay. And here was a big one, right? How to unplug from social media, right? A lot of these students who are doing this, right, they took some active time not to engage in social media before bed, right? Really smart, because if that last thing you have is whether or not it was good or bad, you could be waking up with the anxiety of that, right? But so how to take a break from social media becomes really important. Okay. Social media purge. We also realize, right, social media is not going away, right? So we have to live with it. We have to manage it. And how do we engage with it? Okay. You are all troopers, right? You're troopers. All right, we got a little bit of time. I hope that really just kind of offered you, right, possibilities and a roadmap, right? And this does become a bigger lift. But as counseling departments in schools, I think we have to start looking towards this long-term game, right? Where do we want to be in 5 years, right? That's the question, and I think that's part of what we have here as an integrated model of care, right, is using the resources around us. How do we leverage technology, right, to increase the quality of care for our students? Okay. All right. Thank you. Questions? Comments? I know it's getting close to the end. Yes?
Yeah, I was curious about the chat.
Yes.
Who are the personnel who are managing that? Are they mental health professionals? They're students?
So thank you for bringing that up. See, I wasn't trying to sell you chat. So, but we have on the back end of that, right, our chat counselors. They are bachelor's level, usually in the mental health field, and they're all trained through our curriculum, right? And they're all supervised. All chats are supervised, master's level, and most of them are licensed therapists on the back end, right? Because we're really concerned about quality of care as well. And we know that sometimes a student could engage with chat support and they've minimized what's going on, and sometimes you need someone with a higher level skill set to take over, and we have that capability. So. Yes, yes, there's no bots. These are real people. It's in real time, 24/7. Thank you, good question. I hope to really further the conversation. Please feel free to reach out to me. Or Dr. Edwards as well. Again, he really wanted to be here. He had a family emergency that he was not able to make it with his son. And again, family comes first. And so Dr. Edwards and myself are available to talk, because we know, again, it's going to take a team of people to put this together, right? And we can help you do that. Okay? All right. Thank you.